my name is Olga, and my husband and I. My husband is a minister. He's a pastor, senior pastor in the largest Russian-speaking church in New Hampshire. And our church is small, but we try to do our best. And the message of hosting, fostering, and adopting sounds very often, very frequently in our church, because this is the essence of our faith. And many families, including our family, have been hosting, fostering, and adopting. We adopted a 13-year-old girl. And when I've heard about this new law being implemented, I really felt compelled to come here, even though I don't feel very well right now. But because I have been working in the healthcare field as a medical interpreter for 19 years, and currently I'm working in the largest hospital in New Hampshire in Lebanon. And I'm working with very sick patients every day, but I am able to exercise my religious right not to go for flu vaccinations, right? And the hospital does accept that and does recognize that. And I really felt like it, in our church, many families, they do not vaccinate against flu because a flu vaccine was not even something we had in Russia. We did not have flu. Flu was a minor illness that everybody was just seeing as a positive thing, as something that improves the immunity of a child. And that would definitely exclude families from our community, and I don't even know how we can spread the message of hosting and fostering and adopting if that would be the case, if that would be an obstacle, because this is a real obstacle. And not only that, but also I wanted to say that when I've heard that, I also felt my family, we not only hosted a child that we wanted to adopt multiple times, but we also hosted children that were not able to get along with American-speaking families because of their reactive attachment disorder, and they didn't speak the language. So my family would be called upon, like, hosting children who otherwise would went through so much tremendous trauma that I wanted to share, because I think this is important. Because when I heard about, necessity of getting a flu vaccine, I was thinking, do people realize that children that we host and foster, they had been abused, raped, sold for human trafficking. They've been through tremendous trauma. It's hard to talk about it, but my daughter, when we adopted her, she told me, she said, "Mama, I don't understand, how could somebody sell me? I don't understand, how do people sell people? I don't understand." And she was screaming for 3 months. She was sleeping in the same room with us because she was so traumatized. And she's a gypsy, and because of her nationality, she was badly discriminated and put through so much, and she's a wonderful girl. She goes, but she didn't know her age up until she turned 10 years old. She didn't know any letters, any numbers. She was trained how to steal and cheat, and right now she is one of the best students in private Christian school, and she's doing so well. We're so proud of her, and I cannot imagine us not having her in our family. And to be honest with you, there are some lines that we cannot cross. Like, I cannot absolutely get a flu vaccine, because when we immigrated, I didn't know much about vaccines. I put myself through all the vaccinations we had to get upon immigration, and I passed out for the first and last time in my life. And then recently, right after that, I was diagnosed with autoimmune disease that I'm still struggling with, and I've been interpreting for 19 years, and they say, vaccine reactions are 1 in a million, but I've seen 5. I've seen 5 children regress, healthy children, and parents share the same story. They share with doctors, and I do interpret, and then I say goodbye, and then I go to pediatrics, and I do interpret for babies being vaccinated with 12 vaccines at the time sometimes. And so I just wanted to share this, and I really hope that this law is not getting implemented, because I think it's really unfair. These children, they cannot speak up for themselves, and many of the families don't even know we have this hearing right now, and I think many more would show up. But thank you for